We've touched on a couple of the important things in our preseason evaluation that you might look for in terms of risk of heart disease in an athlete. You had mentioned before personal history of syncope, family history of sudden cardiac death, some of the things related to Marfan syndrome. Are there other critical elements of the preseason evaluation that you do to really look at an athlete and say, does this guy have a risk for heart disease that could interfere with his health?
You know, the roles that we have are very different. And depending on where you live, primary care doctors handle this in different ways. Typically what a primary care physician should be doing, whether it's a family practitioner or a pediatrician, is first of all getting a clear-cut family history. Has anyone young, and we're talking about 40 or younger, died suddenly? Is there a history of muscle disease of the heart in the family? The other thing you obviously find out about family history, which may be relevant, is anybody with a pacemaker. Has anybody had a history, or a first-degree relative, a parent or a sibling, that has episodes where they're passing out with exertion, may be treated with medication, may need a pacemaker, or has a pacemaker. And then when you talk to the individual, what you're looking for is exercise-induced syncope. Certainly exercise-induced chest pain, although, as I mentioned before, is not the hallmark of a lot of these diseases. You certainly ask about it. Children that have frequent palpitations may raise something in terms of an arrhythmia. So you get a relatively concise but critical history of what you're looking for. And then obviously you do a physical exam. You're looking for a stigmata of Marfan syndrome. You're looking at high blood pressure. You're looking for murmurs. The problem is what happens when you stop there. You've done your history, you've done your physical. Is that enough to say to someone who wants to play football, go ahead and play football? That's the controversy, and it is controversial about whether or not that's all you need. And you can obviously ask me the next question is, what do I think about it? But it is controversial. It's not that obvious.